Hello everyone. Today we will be learning about Myasthenia gravis. So what is Myasthenia gravis? Myasthenia gravis, the name has been derived from three words: myas, which means muscle; asthenia, which means weakness; and gravis means severe. So in short, it means severe muscle weakness. Myasthenia gravis is characterized by weakness and rapid fatigue of any of the muscles under voluntary control. It is a chronic autoimmune disorder which is characterized by fatigue and severe weakness of skeletal muscles that worsens with exercise and improves with rest. The incidences are: women are usually more frequently affected than men. The age of onset is usually 20 to 30 years. Myasthenia gravis is caused due to breakdown between the normal communication between the nerves and muscles. The communication between nerves and muscles takes place through neuromuscular junction. Acetylcholine is one of the neurotransmitter which acts as this communicator. The neurotransmitter is released from the presynaptic membrane. It traverses the neuromuscular junction and then it goes and binds to its specific receptor, which are known as cholinergic receptors on the postsynaptic membrane. Here in Myasthenia gravis, this communication between the neuromuscular junction is affected. As such, there is no cure for Myasthenia gravis, but treatment can help relieve signs and symptoms such as weakness of the arm or leg muscles, double vision, drooping of eyelids, and difficulties with speech, chewing, swallowing, and breathing. The various symptoms of Myasthenia gravis are weakness of eye muscles, which leads to ptosis or drooping of the eyelids, patients complaining of severe fatigue and weakness by the end of the day, facial paralysis, change in voice, drooping position of the head, difficulty in talking, difficulty in climbing the stairs, difficulty in lifting objects, difficulty in chewing, swallowing, or the patient might also have difficulty in breathing. So what are the causes of Myasthenia gravis? The cause of Myasthenia gravis is there are antibodies which are produced. As we discussed earlier, the antibodies are produced against the cholinergic receptors which are present on the postsynaptic membrane. The nerves which communicate with the muscle, they communicate with the help of releasing chemicals which are known as neurotransmitters. These neurotransmitters fit precisely into the receptor sites on the muscle cells at the neuromuscular junction. In Myasthenia gravis, elevated titers of antibodies are found against the acetylcholine receptors. Another cause of Myasthenia gravis might also be the thymus gland, which acts as a trigger or maintains the production of these antibodies which block the effect of acetylcholine. The pathophysiology of Myasthenia gravis, the presence of Myasthenia gravis is due to etiological factors. These etiological factors lead to presence of autoimmune disorder. In this autoimmune disorder, there is destruction and blockage of the neuromuscular junction postsynaptic receptor sites by the antibodies. These antibodies block the neuromuscular receptor sites, and due to this there is decreased availability of free receptors for binding acetylcholine. The decreased number of acetylcholine receptors also leads to structural changes in the postsynaptic membrane. Due to all these effects, there is diminished acetylcholine uptake. Because there is diminished acetylcholine uptake, this leads to decrease in the muscle ability to contract despite having sufficient amount of acetylcholine. These two diagrams can help us show about the differences between the pathophysiology of Myasthenia gravis. In the first diagram, as we can see, whenever acetylcholine is released from the neuron, it traverses through the neuromuscular junction and it goes and binds to the specific cholinergic receptors present on the muscle. As can be seen on the second diagram in Myasthenia gravis, the specific acetylcholinergic receptors are blocked by the antibodies which are produced by the own body. That is why they are known as autoantibodies. Hence, it is known as autoimmune disorder. These antibodies block the receptor sites which are available. So as we can see, there is decreased availability of receptor sites to bind the normal amount of acetylcholine which is released from the presynaptic membrane. Because there is less binding of acetylcholine on the postsynaptic receptor, there is reduced transmission of the signals to the muscle. Because of this, there is impaired muscle contraction. What are the clinical manifestations? Ocular and facial features might include ptosis, which is drooping of eyelids, diplopia, which is double vision because of extraocular muscle weakness, facial weakness on one side, dysphagia, difficulty in swallowing, dysarthria, difficulty in talking or speech disturbances, difficulty in closing the eyes, aspiration difficulties which might lead to impaired communication. Musculoskeletal clinical manifestations might include severe weakness and fatigue of the muscles, decreased function of hand and arms, legs and neck muscles. Respiratory clinical manifestations in severe cases might be weakening of the intercostal muscles, decrease in diaphragm movement, breathlessness and dyspnea, poor gas exchange. Nutritional clinical manifestations might include inability to chew and swallow, decreased ability to move the tongue, impairment of fine motor abilities, which might eventually lead to weight loss, dehydration and malnutrition. Another complication of myasthenia gravis might be myasthenic crisis, which is a life-threatening condition that occurs when the muscles that control breathing become too weak to work. The patient might present in the emergency department and mechanical assistance with breathing will be needed. The complications of myasthenia gravis also might be due to presence of thymic or thymus gland tumors, which are known as thymomas, and they are usually not malignant. Cholinergic crisis might be present due to overdose of anticholinesterase medications. Also, these patients of myasthenia gravis are more likely to have other autoimmune disorders or conditions like rheumatoid arthritis or lupus. So, how do we diagnose a patient of myasthenia gravis? By history, physical examination, specific test which is known as anticholinesterase tensilon or prostigmine test, ice pack test, blood analysis which may reveal presence of abnormal antibodies against the acetylcholine receptors, electromyography, which is again of two types, repetitive nerve stimulation, and second is single fiber electromyography. The physiological basis of management of a patient of myasthenia gravis includes giving medications like substances which are choline esterase inhibitors. As we all know, choline esterase is an enzyme which destroys acetylcholine. So when we give choline esterase inhibitors, whatever little amount of acetylcholine is able to bind on the free available sites can continue to act for a longer period of time. So drugs like pyridostigmine, physostigmine, neostigmine, these are choline esterase inhibitors. They improve the communication between the nerves and muscles. These medications aren't a cure, but they can improve muscle contraction and muscle strength. Second mode of treatment is glucocorticoids like prednisone and immunosuppressive agents like cyclosporine or azathioprine. IV therapy like plasmapheresis may also be given, but this is usually given in patients of emergency who are having a filtering process which is similar to dialysis. The blood is routed through a machine that removes the antibodies that block the transmission of signals from the nerve endings to the muscle receptor sites. Some patients might also benefit by removal of the thymus gland, which is known as thymectomy. In conclusion, myasthenia gravis is a very complex disease with many different signs and symptoms which may be quite noticeable or they may be vague, but it is mainly an autoimmune disorder, and the presenting symptoms of ptosis or diplopia should cause the clinician to consider a workup for myasthenia gravis. Thank you.